As I review the selected axial CT images of the brain, both pre and post contrast, I observe a mass centered in the right parietal region. The mass is extraaxial, which I deduce from its broad base that is adjacent to the calvaria. On the pre-contrast images, the mass is heterogeneous but predominantly of high attenuation. The presence of calcifications within the mass is also noted. After contrast administration, there is patchy enhancement of the mass, which is suggestive of its vascular nature, possibly a meningioma. I carefully examine the bony windows for any signs of bony erosion or hyperostosis, which could suggest an aggressive lesion. However, I do not identify any gross bony destruction. The surrounding low attenuation adjacent to the mass could represent vasogenic edema, which often accompanies such lesions. Interestingly, I note that this low attenuation extends to the cortex anterior to the mass, which might indicate a chronic process such as an old infarct. Despite the mass effect, there is no significant midline shift, although there is mild effacement of the posterior horn of the right lateral ventricle, indicating some degree of mass effect. Additionally, I notice an abnormality in the left parieto-occipital region, characterized by homogeneous low density involving both gray and white matter, without any evidence of mass effect. This appearance is consistent with a recent infarct, which could explain the current clinical presentation. To summarize, the two most significant findings are a right-sided meningioma and a recent left parieto-occipital infarct. The meningioma is the likely cause of the patient's symptoms, and the infarct appears to be an incidental finding, but might contribute to the clinical picture, depending on the patient's history and presentation. Given these findings, my recommendation would be to convey this information to the referring clinicians, emphasizing the need for potential neurosurgical consultation regarding the meningioma, and to consider the appropriate management of the recent infarct, which might include stroke care protocols.